Hello, Specialized Insurance Claims students. It's your instructor, Kathy Spahn. Thanks for joining me for today's presentation to help you take your diagnostic coding skills to the next level. The objective of this presentation is to familiarize the student with the actual ICD-10-CM coding manual. Note it is not intended to replace reading Chapter 4 of the textbook, as I will not cover all the information found in the chapter. Be sure to read the chapter and make note of all the great illustrations, figures, and tables provided throughout the textbook chapter reading. Available through the Madison College free rental program, each student should have two large coding books. One is entitled ICD-10-CM Expert and one entitled CPT Professional. This week, we will concentrate on the ICD-10-CM coding book. The codes found in this book are for diagnoses, or what is wrong with the patient. We'll cover CPT coding next week, which concentrates on coding services and procedures. ICD-10 refers to the International Classification of Diseases. The book is updated every year. Note, however, that for our purposes, it is okay if we are not using the most current edition. Also, the college's rental program requires books are rented for a minimum of 3 years before updating books. As students in this class are not studying to become certified medical coders through the American Health Information Management Association, or AHIMA, we will learn the fundamentals of coding. Because the books are rented, be sure to not mark in the books. I suggest using post-it notes or flags if necessary. Grab your ICD-10-CM manual and let's get familiar with this book together. Now that you have your ICD-10-CM coding book in front of you, it's a large book, isn't it? The ICD-10 Medical Coding Manual contains about 70,000 codes, all for diseases, conditions, syndromes, injuries, diagnoses. That's a lot of codes. With the most recent expansion of this code set to the 10th edition, codes are available for any reason imaginable, and some not so imaginable, and some a little comical. Take a look at the codes shown on this slide. Y93.84 is the diagnostic code for injured while sleeping. Well, I guess I could imagine some instances where someone could injure themselves while sleeping. W61.43 is the diagnostic code for pecked by a turkey. Problems with the in-laws? There's a code for that, which is Z63.1. Ever been burned while water skiing? V91.07 is the code for this event. Okay, let's get started and take a tour of this manual. Page through your ICD-10 manual with me. Feel free to pause the video if necessary to find an entry or page. Page 3 walks through the steps to assign a code. Our textbook does a good job of further explaining this. However, this is an easy reference if needed. Each page of the Tabular Index contains many symbols and signs. Pages 4 and 5 further explain what these mean and when they might be needed to be considered. We'll look at the Tabular Index in a few minutes. Starting with page 11, there are many pages containing anatomical illustrations. These might be a good reference when looking for a code to determine where something may be located in the body or specific organ. As a side note, when I worked for surgeons at UW Hospital, I used to assist them with submitting research study results into professional medical journals, such as the Journal of the American Medical Association, otherwise known as JAMA, and the New England Journal of Medicine. You may have heard of these well-known medical journals. I used to work with the hospital's medical illustration department where artists drew these types of anatomical illustrations. I always loved picking up artwork to see what they were working on. So that's just a quick fun fact. Note the right side of the pages of this book are color-coded. Each chapter is a different color. Chapters are divided by specialties. This helps the coder efficiently find a specialty. The gray page section makes up a pretty large portion of the ICD-10 book. This is where all possible diseases, diagnoses, symptoms, and injuries are listed. The first section of the gray pages is the Index to Diseases and Injuries and is referred to as the Alphabetic Index. Other reference sections of the gray pages include the table of neoplasms, the table of drugs and chemicals, and the index to external causes of injuries. Look at the top margin of the right page or along the gray sidebar of the page to confirm which section you are looking at. Let's take a look first at the Alphabetic Index, which is the Index to Diseases and Injuries section. This is where you will spend a majority of your time. Main diagnostic terms are organized by condition, not body part. Diagnosis coding starts by looking up possible matches in the Alphabetic Index. The textbook explains the 6 steps to assign a medical code, and I will not repeat this information here. However, once the main term for each condition is abstracted from the medical documentation and identified, the coding process begins by locating main terms in the Alphabetic Index. Coding must always be as specific as possible with the documentation available from the patient's visit. You learned in Medical Administrative Procedures class that diagnostic codes begin with a letter. Keep this in mind as you assign ICD-10 diagnostic codes. In your ICD-10 book, in the Index to Diseases and Injuries sections of the gray pages, otherwise known as the Alphabetic Index, locate the term disease. Find where it begins. Use the 2 guide words found at the top of the page and on the gray sidebar area of the page to help you find where the term disease begins. Pause the video if necessary until you find the beginning entry for disease. Note that the term disease is in bold because it is a main term. Now, notice all the different types of diseases listed under the main term. These are all called subterms. There are several pages, right? Lots of diseases. I am showing you this so you pay attention to when looking up terms in the Alphabetic Index and realize the entries could be numerous. Let's look for the subterm cerebrovascular under that main term disease. Again, subterms are listed in alphabetic order and are indented a bit. Note there may be further subterms which are further indented. The yellow vertical lines in the index are printed to help the coder's eyes easily see the indentations. If our patient documentation does not specify anything more specific for the diagnosis of cerebrovascular disease, we would begin looking at the code I67.9 as the correct ICD-10 code. Because all diagnosis codes begin with a letter, note this is not a number 1, but the letter I. Assume the patient's documentation specifies acute thrombolytic cerebrovascular disease. Note the hierarchy organization to find such a term. Under disease, under cerebrovascular, under acute, you will find thrombolytic. We would consider I63.3 for this diagnosis. I say consider because we never code just from the Alphabetic Index section of the coding book. The possible code is next confirmed in the Tabular Index, the colorful pages towards the back of the book. We'll come back to this in a few minutes. Taking our example one step further, if the diagnosis is acute thrombolytic cardiovascular disease, how does a coder know what term to look up? This is the skill that is learned by experience, and you will get better at this the more you assign codes throughout this class. If acute thrombolytic cardiovascular disease is the diagnosis listed on a patient's medical documentation, the novice coder might start by looking up the first word, which is acute. Let's give this a try. Take a minute and look up acute in the Index to Diseases and Injuries section of the Alphabetic Index, the gray pages. Pause the video if you need. What is listed for the term acute? You will note there is a cross-reference directing you to look up the condition. What kind of word is acute? What part of speech? It is an adjective. It describes the type of cardiovascular disease. Okay, we struck out trying to find this diagnosis under the term acute. Let's try thrombolytic. Look up this term in the Alphabetic Index. Stop the video for a second and look. What did you find? This term is not listed at all, right? The term thrombolytic is also an adjective. Let's try again. What if we look up cardiovascular? Take a second and look up this term, then start the video again. We have found another cross-reference to condition, correct? Well, what is a condition? A disease. What type of word is cardiovascular? What part of speech? It is an adjective. Are you seeing a pattern here? Looking up the noun of a diagnosis is typically the most efficient. In this case, disease is the noun. All other words describe the kind of disease and are adjectives. Medical coding is investigative work. Sometimes the term is not specifically found as documented in the record. And this is where advanced medical terminology skills are required. So I just said typically it's best to look up the noun of the term, right? Not always. Here's an example. Look up Meniere's disease under M for Meniere. Note the possible code of H81.0 is listed. This term is not listed under disease or syndrome. Note this term is capitalized. It is an eponym and is listed separately. What is an eponym? It is a term named after someone who discovered, invented, or did something notable in medicine. Therefore, we can assume Meniere is the name of the person who discovered this disease. If you look up Meniere's syndrome or disease, you will see it is named after a French physician named Prosper Meniere. Again, experience with assigning codes will help with efficiently finding terms. As mentioned earlier, there are 3 other additional reference sections to the gray pages. These follow the Index to Diseases and Injuries sections in the order shown here. Turn to the table of neoplasms. Refer to the top right page and/or the gray sidebar for assistance. The coder references this table to code an abnormal growth of tissue from some part of the body. Note the term and possible codes depending on the results of the specimen, shown in the columns to the right of the neoplasm term. For example, suppose the diagnosis was benign tumor of the ileum. In this table, look up ileum, I-L-E-U-M. The documentation specifies benign. Therefore, move across this row to the benign column and we can begin considering code D13.39. Similarly, look at the table of drugs and chemicals. This is where the diagnoses of poisoning and unwanted effects would be located. The index to external causes and injuries is used to code accidents and workers' compensation claims. We'll use this in Chapter 12 when learning about workers' compensation coding and claims. After the gray pages of the ICD-10-CM manual, you will notice color-coded chapters. All these chapters make up what is known as the tabular list of the coding manual. Codes are organized by body system, purpose, or etiology. What does etiology mean? This means the cause of a disease or condition. A patient's clinic note may state the diagnosis as a fever of unknown etiology, meaning there is no clear-cut reason for the patient having a fever. Or the documentation could specify the patient has a fever due to strep. In this example, strep is the cause of the fever. Just a quick example of what is meant by etiology. Again, please refer to the textbook Chapter 4 reading, which further explains the 21 chapters found in the tabular list. The textbook explains the alphanumeric characters that make up an ICD-10 medical code. Most final codes have 3 to 7 alphanumeric characters. For quick review, the first 3 characters are a category. The first character is a letter. Subcategories are terms that further describe a condition or injury and include 4 to 5 characters. The final code is the most specific alphanumeric entry and can contain 3 to 7 characters. This is the final code that is recorded and submitted on an insurance claim. Let's give this a try. Do this with me. Let's find the diagnostic code for the diagnosis of Achilles tendonitis on the left. We would start by finding the term in the alphabetic index, right? The gray pages. If you try to find Achilles in the alphabetic index, you won't find it. Look up tendonitis. Find Achilles listed under this main term. The corresponding code is M76.6. Jot this down on a piece of paper. Use your ICD-10 book to further confirm this code with me. First, find M76 in the Tabular Index. Use the guide words on the top of the pages to find where codes beginning with the letter M begins. This is found in the chapter of the diseases of musculoskeletal system and connective tissue. Now locate M76, which is the category code. This includes conditions of enthesopathies, lower limb, excluding the foot. M76.6 was the code found in the alphabetic index for tendonitis Achilles. Locate M76.6. Note the subcategories listed under this. We always want to find the most specific code with the documentation we have. You will see that the diagnostic code for this diagnosis is M76.2, Achilles tendonitis left leg. The correct code for Achilles tendonitis on the left is M76.62. There are just a few additional hints I'd like to cover before I sign off and let you dig into assigning ICD-10 medical codes. Some conditions and illnesses are chronic, meaning they continue over a long period of time, and some conditions are acute, typically a sudden or severe problem. Correct codes must be assigned accordingly. In the coding book, you will encounter the abbreviations NEC and NOS. NEC stands for Not Elsewhere Classified, which means no code exactly matches the condition. NOS means Not Otherwise Specified, referring to the medical documentation not providing further specific information, such as if an injury is on the right side or the left side. Some NEC and NOS codes are not billable, meaning a claim with these codes could be denied. Take a look at your coding book. Note the red circles next to category and subcategory codes. The number inside the circle refers to the number of characters required for that code. Let's look at our example of Achilles tendonitis. Look at category M76. The red circle tells us we need a fourth character. When looking at the fourth character choices, these further show us a fifth digit is required to be as specific as possible. Some codes require a seventh character extension. This character must always be in the seventh place of the code. If there aren't enough characters for places 1 through 6, the letter X is used as a placeholder. Usually the seventh character refers to the sequence of visit. For example, the seventh character A is for an initial encounter, the first time the patient is seen for this condition. D is this subsequent visit for the same condition. Extension S refers to sequelae, which refers to residual or late effects of a condition that remain after the illness or injury has ended. Most codes in Chapter 19 require a seventh character extension. We don't always go to the doctor with a specific illness or injury, right? Consider the examples on this slide. We don't always have a specific condition, such as an annual physical examination. The last chapter of the Tabular List encompasses these codes, which begin with the letter Z. Explore this chapter a bit on your own, as assigning Z codes can be a little tricky, and the documentation must always provide medical necessity. Thanks for joining me for this introduction to the ICD-10 Coding Manual. I hope it has provided some additional information to get you ready to assign codes. As with any skill, practice makes perfect. Assigning codes is challenging and investigative work. The more terms you code, the better you will get at finding them and being confident in your decision of a code. Have a great week, everyone.